How did I get here? I kind of feel like the good dog in the back seat on the way to the vet.
Look as far as I can see, but you don't want to talk to me, no. And not through words, not through songs, not through whispers, not through phones. When I look at you, I know that got me in a state of mind, traveling through wasted time. Think of how I will rewrite every single song.
Say hi, baby.
Hi, baby.
Walk as far as I can go now.
This isn't what you might think. I don't really know how to explain it. Maybe it's that we all have something going on in our lives. Life, loss, happiness, tragedy, health, or not. Something is always weighing on our minds. Some find a way to deal with whatever it is. Others struggle. Hopefully we can sense those in need and can lend a hand when it's needed. Every day, someone you know or see may be dealing with demons, physical or mental. Some of us just need a little time to work it out. This is just a little bit about friends, family, and their love.
Of mine, traveling through wasted time. Think of how I will rewrite every single song.
So why am I riding in the back seat? I'm used to being the driver. Well, today I'm thinking about the last few years and what's led up to this point. It actually began way before that, while I was still working for fire. One of the really good things about the job is the health screening. The bad thing is you're exposed to more dangerous things and stuff than you can imagine.
Being overgrown, I think of passing by, round the corner, meet my eyes. I don't know what we would say, but got me in a state of mind, traveling through wasted time. Think of how I will rewrite.
So why am I riding in the back of this car, like a good dog on his way to the vet, with Chuck and my wife up front?
Wasted time. Think of how I will rewrite every single song.
Well, while I was at one of those screenings, one of the tests called PSA showed an abnormality. I went to my doctor and he confirmed but was not concerned at that time, although we would test more frequently to see if it was trending one way or the other.
Walk as far as I can go now. I keep repeating overgrown. I think of you passing by, round the corner, meet my eyes. I don't know what we would say, but
Over the years, it slowly climbed. All the internet gurus claimed it was over for me, and a couple of years ago, that value, the PSA, spiked. PSA is Prostate Specific Antigen. So I was to have what he called a simple office biopsy. I was given basically a Valium and a local numbing agent. Then a needle biopsy device was placed somewhere I'd rather not describe here, and 24 samples of prostate tissue was taken. Not pleasant at all. A couple of weeks later, the results came back negative, so we went into the wakeful watching phase. A year and a half or so later, and another upward trend, so another biopsy. This time under full sedation, outpatient, and another 24 samples taken. Only one small part of one sample came back positive. Not enough to warrant surgery or radiation or chemo, but enough to classify me as having cancer. What does that mean? Here are some statistics. Second only to skin cancer, prostate cancer is the most common cancer in American men. About 191,930 new cases and about 33,330 deaths from it. Risks: 1 in 9 men will be diagnosed during his lifetime. It is more likely to develop in older men. Sadly, in the African American man, it is 6 in 10. Above 65 years of age. The average age of diagnosis is 66. This cancer is the second leading cause of cancer death in American men, behind only lung cancer. There are about 3.1 million men alive today with the diagnosis. Well, never being one to let anything hold me back and having confidence in my physician, my wife and I changed our lifestyle and began our odyssey. A few months ago, we flew back to see my doc and reassess. I wasn't very happy. The PSA was up again, so another biopsy was warranted. When we got back, he had me set up for the procedure. It was now more complicated, involving a COVID test and pre-screening for the samples. Now realize that a man's prostate is normally about the size of a walnut, but with smooth surfaces. A rough surface is abnormal and something the doc can find in a simple digital exam. Mine have always been normal. He was going to take another 24 samples. That is 72 to date, and I can't imagine much other than scar tissue being left. The procedure is not fun. Look up prostate biopsy on YouTube, and you'll see what I mean. It seems almost medieval. I'm not fond of being under, but my doc is good, and the anesthesiologist didn't snow me so much that within 15 minutes in recovery, I was ready to go home. Chuck was orbiting and quickly picked us up and took us home. That night, I spiked 105 plus fever and couldn't get warm. Being a little too much for Shelley to handle, she called Chuck and the doc to bully me into going to the ER. Again, Chuck picked us up and took us back to St. Joseph's for more IVs, IV antibiotics, and a 2-week supply to take home, along with 2,000 milliliters of lactated ringers, and we were back home again. The nature of the surgery and open wounds were a breeding ground for a bacterial infection, but which now would be under control. It took 3 weeks for the lab to finalize the results, reevaluating several times. No cancer found, thank God. Now that doesn't mean that I don't have cancer. I do, it's just not showing itself for now. Personally, I'm betting a city bus gets me before the cancer, but we'll continue to watch closely. Now, I know some of you will say, just take it out and be done with it. That's yours and your doctor's choice. We've decided to go the road we have, and that is subject to change as the situation and my condition changes. So why am I sharing this with you? Well, mainly because too many men die from this cancer because they were never proactive enough to get a checkup. Guys, if you're over 40, you should be considering getting a urologist. Your PSA needs to be done regularly so they can check for trending. It's a simple test, and you don't even have to study for it. The digital exam is not as comfortable, but is vital as well. That's why you should get a doctor you trust. No big deal. Corinne, the tech, was very nice. Told me I could have my choice if I wanted the swab up the nose or the saline flush. Of course, I chose the saline flush. I'm asking all of our team and anyone who this video reaches to please get the checkup. Save your own life and encourage others to do so as well. For what it's worth, the blue ribbon is for prostate awareness. I hope that our experience can help and/or encourage someone else to get help. See you again next week. We love you all. Please, travel safe.